welcome, Mr. Parrish. I hope it's okay that our therapy dog is sitting with you.
Yes, it is. Thank you.
First, I want to mention a couple things. I'm a mandated reporter, so what that means is that there's limits to our confidentiality. Say, for instance, there's a risk of suicide, or there's elder abuse, disabled persons abuse, or child abuse. I have to report it. But other than that, everything else is kept confidential.
Okay.
So is that okay with you? Do you want to continue the session?
Yes, I'm fine with continuing
Okay.
the session.
So what brings you in today?
I'm currently in a graduate program finishing up my master's in educational administration, and I'm just kind of getting really overwhelmed with the program. I feel like I'm not going to be able to complete it. Um, it's more than kind of what I expected coming into the program, and I'm afraid of failing, and I'm not used to having that feeling, and I don't know how to process it.
Have you ever failed before?
Um,
Like what triggered those feelings?
it's I almost feel like really overwhelmed. That anxiety, it's keeping me up sometimes at night. Like I am used to getting A's and B's in some of the courses. I'm getting C's in, and I can't really figure out what the professors are looking for. It makes me think maybe this isn't the career path for me.
So if you get a C, does that mean you failed the course, or it just looks to you that your grades are slipping?
It looks to me like my grades are slipping, and it makes me feel like this isn't the career for me because everything's come so easily for me.
But do you enjoy it? Do you enjoy the classes? And when you do succeed in the class, do you feel accomplished? Like you look forward to the future?
Yes, I do.
Okay.
It's definitely a field that I want to be in for my entire career. I just think maybe it's not what I expected coming into maybe.
Okay.
And so that's where that sense of failure is coming from, because everything's come so naturally to me, throughout my entire coursework of school, from my bachelor's degree to getting my teaching credential. I didn't have to study. I could just kind of sit through a lecture and I'd ace everything without really putting much effort in. And so maybe that's where these feelings are coming from, because it's not as easy as everything else has always been.
Okay. And then what kind of feelings are these bringing up when you do have those thoughts?
It's a feeling that I feel like I'm letting everybody down. And so, not just myself, but like my loved ones, my family, co-workers, because they all know that I'm going through this, and it's like, it's almost like they're looking up to me to be able to do it, and if I don't achieve that, it's kind of like I think I'm letting them down more than I'm letting myself down.
So any like feelings though, as far as like anxiety or like physical feelings when you have these thoughts? Do you experience those?
Like I start kind of getting shaky, my hands really get sweaty, kind of clammy. Sometimes it kind of feels like it's hard to breathe at times. It's almost like an anxiety, not a panic attack,
Yeah.
but just a lot of anxiety when I
Like
start
leading
feeling
up to it almost.
Yes. And then I just really get it caught up in my head, and I have to break that cycle and be like, it's okay, because it starts getting me sad.
Okay, so you kind of calm yourself down.
Yeah.
So, but it hasn't really been working?
It really hasn't been, because these thoughts keep coming back.
Okay.
And so I don't think I'm really kind of eliminating that sadness.
Okay, so I don't know if you've ever heard of cognitive behavioral therapy.
No, I haven't.
So basically, from the cognitive behavioral point of view, it has a lot of reliance on the thoughts that we have, and the thoughts lead to feelings that lead to behavior. It's like the ABC model.
Okay.
So once we have an activating event, say for instance you're feeling or your thought of failing, you start having the beliefs, and then that leads to consequences. So that's how you behave.
Okay.
So what CBT therapy does is it helps you gain some distance between your actual thoughts and your feelings and your behaviors.
Okay.
So once you notice that you're having that, we'll say a negative thought that you're failing, because there's really, I mean, what's the evidence that you're failing? You haven't had any F's,
No.
your professors haven't given you any letters saying, you know, you're gonna fail, right?
Correct. No, I haven't gotten any of that, and I'm still getting A's and B pluses.
Which
so.
is awesome.
Exactly.
So really, and you're catastrophizing in your mind, and you're going down this spiral like, I'm failing, and then you have these images, okay, like the what ifs, but there's no evidence to it.
Correct.
So the CBT skills and interventions that we can implement in therapy is they'll help you to examine the evidence, and examine the rewards and the costs.
Okay.
So there's worksheets that we can do, there's like imagery, there's you can also do like counting down to calm yourself from 10 to 1.
Okay.
So let me give you some worksheet
Okay.
that you can kind of take home and fill out when you're feeling these, when you're having these thoughts.
Okay.
Let's see. Then you can fill them out. So it would be like a fear list. So you can
Okay.
write down your fears, the worst case scenarios, and then things you can do to prevent the failure. Like if you start feeling these thoughts, maybe you can reach out to your professor
Okay.
and ask, like, you know, how am I doing, or is there anything I can work on, or ask for help, because that's what your professor's there for anyway.
And I think that's where it comes from too, is a lot of times the professors aren't grading the assignments until really close to the completion of the course.
Yeah.
And so I'm not getting any feedback on my grades, and I don't know how it's going because I'm not seeing the results.
Oh, okay.
And so that might be leading to that kind of thought process also.
And then you have that time to do all the what ifs, like
Yes.
what if I fail?
Exactly.
Okay. So anyway, the worksheet can, you know, you can write all those feelings down
Okay.
too. And then, so here's that, you could take that home.
Okay.
And then there's also
And
other,
then bring this to our next session?
yeah, you can
Okay.
bring that to our next session, or you can even use it to reflect. Like, it's like your thought journals, so you'll write all those thoughts down, those feelings, and then maybe pause for a moment, like even the night, sleep on it, and then the next day reread it, and then say, okay, like how did I deal with it? Or what was the outcome of all those feelings and thoughts?
Okay.
Kind of like reflect on it.
Okay.
And then we can talk about it during the next session.
Okay.
And then what else? There's also, for your anxiety feelings, there's like an imagery walk you could do. You can close your eyes and think of your favorite place to go, like the beach or the woods, and you can just imagine yourself on a walk. Close your eyes, calm yourself down.
Okay.
Think of yourself there, feel the sand in your feet,
Okay.
and then breathe.
Okay.
So, let's see what else. So how do you think the cognitive behavioral approach might help? Do you think these tools might be effective, or do you see yourself doing some of the homework?
I do see myself doing this. I think like the fear list, kind of just getting it out of me and just expressing it on my own paper and saying, this
Yeah.
is what I'm afraid is gonna happen, and then really seeing how I can not have that happen.
Right.
By, you know what, staying on top of my grades, like you said, kind of reach out to my professors, see how they're doing, and kind of see that these thoughts aren't realistic. It's just things that I'm kind of coming up with because of my own anxiety and
Yeah.
that fear. And then I'm hoping that won't create any sadness for me.
Right. Because it's kind of like the all or nothing thinking, or the jumping to conclusions, and then you're discounting the positive. You're not thinking, okay, well, I do get good grades, you know, and you're already working in a really good position, right?
Correct.
So, I mean, you've gotten this far. So we just need to help you not stay in that negative mindset.
And I like that idea of just kind of going to my happy place
Mm-hmm.
and remembering where my happy place is and taking it back to that happy place. And kind of remembering Main Street on Disneyland and being happy there.
Exactly. The happiest place on earth.
Exactly.
Okay. So is there any other questions you have, or?
No, thank you for kind of seeing me. I'm really excited, and I really appreciate your insight.
yeah, we just need to keep you focused on the positive. So thank you, and I'll see you next